Hello, everyone, and welcome to the Massachusetts Child and Youth Serving Programs Reopen Approach. This is an introduction for family childcare providers to the reopening process. Today, we are going to talk about the minimum requirements, how to prepare for reopening, what changes you can expect for yourselves as providers and any assistance that you may hire, and supports and resources that will be available through the reopening process. For some background, as you all know, on June 1st, the Department of Early Education and Care released its requirements for health and safety. We did this early in the process to allow for time for providers to prepare to arrange their spaces and their programs to reopen safely during this time of COVID-19. On June 6th, Governor Baker also announced that we would be moving to phase 2. This is part of the Commonwealth's reopening plan, which began on Monday, June 8th. This meant that providers could begin the preparation for reopening, which is now beginning the week of June 15th. In order to reopen, the Department of Early Education and Care released a plan template, a sample attestation form, and revised minimum requirements to guide providers as they prepare to welcome children and families back into their spaces. Now, the week of June 15th, programs can submit their reopening plans and begin the reopening transaction in the LEAD system so that they can begin opening as early as the week of June 22nd. Today, this session's goals are for providers to understand the minimum requirements and where flexibility for programs to design solutions are welcome and desired. We also hope to introduce understanding of the reopening process so that programs are prepared to apply and reopen through the LEAD system. We also want to equip providers to develop their reopening plans using the templates that we have provided or to submit plans of their own design, and understand how those plans will be reviewed by licensors and where the department is ready to help. Finally, we hope to help providers understand what changes will be ready for the workforce in terms of approvals and qualifications, and how that impacts reopening for family childcare providers, as well as what resources are available to support reopening and ongoing operations as you welcome children and families back to care. Now we would like to talk a little bit about the minimum requirements, which, as you know, have evolved since June 1st when they were first released. We continue to iterate on the requirements based on your feedback and requests for clarification and flexibility. The requirements were designed to guide reopening, and at their essence or their core, they are designed to keep children and families and providers safe. The principles of the requirements are listed here below. They are the sort of most essential things that we know are designed to mitigate the spread of COVID-19. It's these two strategies: to minimize the number of individuals who any potentially exposed person is in close contact with by limiting contact between groups. This means that we do not have adults moving between classrooms and we don't have groups mingling together. It also means that we're minimizing the extent to which there's close contact between individuals inside a group to the degree possible. As long as your plans around program design and operations are following these principles to every extent possible, this is the best strategy you can undertake to stem the spread of COVID-19 should it arise within your classroom communities, within your family childcare home communities. As you work with the minimum requirements, we do want to make a few things clear. We recognize that not every requirement is feasible in every childcare space, and that every setting is unique in some way. We also know that family childcare homes on the whole present some very unique settings that don't make the requirements feasible all the time. Children, first of all, are unique in that they cannot always maintain physical distance. Sometimes they need to be close to other children or to adults. Children will move around the home, and it is not our intention that children are forced to maintain physical distance in a punitive way. It is our intention that the way the classroom is configured, and the way activities are conducted and the way transitions between activities are designed is structured to promote physical distance to every degree possible. This means putting stations at a certain distance apart. It means designing inside and outside time transitions so that physical distance is encouraged. It means moving circle time spaces so that children are sitting at a safe physical distance. It does not mean that children have to be continually told to stay apart, or that classrooms need to become punitive spaces in that way. On mask wearing, you will notice that our requirements talk about encouraging mask wearing, but we know that some children will not want to wear masks or may be scared by them. We are not asking providers to force children to wear masks. Instead, it is really up to you and the families of the children in your care to decide on an approach that makes sense for your program. We also want to support your needs for safety and maintaining the health of you and your family. So this really is a mutual decision between you and the families in your care to figure out for your program. We also want to emphasize that we know summer is meant to be fun, and that the environment of the family childcare home is meant to be a really rich learning environment for children to feel safe and loved and nurtured. We know that children also want to run, playing in sprinklers, playing games, and sort of having the carefree days of summer and childhood. We do not want to take these away from children or from your ability to create these days for children. Please know that we encourage you to continue to make childhood fun, and just to do so in a way that minimizes the spread of potential disease should it come into your community. So to do so in as safe a way as possible. Finally, we know that your home is constructed in a certain way, and there may just be one bathroom available. There may just be one entry or exit point. You may not have a separate room to isolate a child should they become sick, and that's okay. We are not asking for additional construction. We are not asking for things that are unrealistic. When your space does not have options that meet the requirements as they're outlined in the current articulation, please propose an alternative in your plans and explain how it fulfills the ideas or the goals of the requirements. So how the space is separate from the childcare space, even if it's not a separate room, for example. And that will be enough to satisfy what we're looking for. We will be flexible in those ways. When it comes down to it, it really is about careful planning. And so we are relying on your expertise and your experience to propose reasonable alternatives. Thinking about the changes, there are 6 key areas that are covered in the requirements, which you are probably familiar with, but we'll just talk through them. And so there are alterations to group sizes and ratios that are recommended to reduce risk. I do want to note that for family childcare homes that were in operation prior to the closure, prior to the executive order closing childcare, you are not required to alter your group sizes and ratios. So your pre-existing licensed ratios and group sizes are allowable when you reopen through July and August. So even though the requirements cite different group sizes and ratios, if you look at the Family Childcare Supplemental Guidance and our frequently asked questions, you will note that your pre-existing group sizes and ratios are actually allowable. So you are exempt from the new required ratios. So please do note that, and in your reopening plans, note that you are planning to reopen under your pre-existing licensed group sizes and ratios, and that will be allowable. New licensees or new family childcares that are opening will be required to meet the required group sizes and ratios as they are articulated. We also ask programs to conduct daily screening on drop-off, and that is a verbal screening with a family that's asking about essentially exposure to COVID within the family unit, and then a visual screening of the child for symptoms. To prepare for potential illness, so thinking through isolation, thinking about communication systems with families. Intensified hygiene practices, we all know about hand washing and just sort of managing through that and thinking through all of the scenarios that will require intensified hygiene. Increased cleaning, sanitizing, and disinfecting. This will probably look different based on the activities and practices that are typical for your family childcare home. And so we ask that you propose what makes sense for you and just make sure that things are stored safely away from children. And then removing materials from the classroom that are high risk. So things like a sensory table that might have had children sharing materials and in close proximity to each other, or things that might represent a risk of spreading disease are asked to be removed from the family childcare home. I do want to just again articulate that the language and the requirements very, very intentionally uses the language of encourage. So it is not, we are not requiring physical distancing and we are not requiring masks, we are encouraging them. There has been a lot of misconception around this. So I just want to be very clear that we are encouraging physical distancing of 6 feet and we are encouraging wearing cloth masks, especially when 6 feet distance is not possible. Finally, I want to point you to the guidance that is available on the Department of Early Education and Care website. This includes the most up-to-date version of our requirements, the health and safety requirements. Especially for family childcare, there is a separate document, which is supplemental guidance that provides options and ideas for where things might be adapted for the family childcare space. And then frequently asked questions on the minimum requirements. The frequently asked questions are really meant to be viewed together with the requirements because they provide additional clarity around the things that have been asked of us frequently, whether through our online question submission form or in person. So please do look at all of these documents as a package. And now we will begin looking at the reopening process.
Great. Thank you, Eli, for walking us through the minimum requirements. And now we're going to talk a little bit about preparing for reopening and what this process will look like. So for the reopening process, we've already released a few material to support this, but programs are going to have to take 3 main steps. The first is completing this reopening transaction in LEAD. And this will become available through LEAD, and you'll be able to see it on your LEAD homepage and click to go start that reopening transaction. And one important thing to note here is you'll be able to start this transaction even if you are in renewal. If you're an expired program, we just want to make sure you started your renewal transaction, and then you'll be able to go in and start that reopening transaction. Within this transaction, second step, you'll submit a reopening plan and a staff checklist in LEAD. And these reopening plans were posted on the website already on EEC's website in an editable version. So for family child care providers, you can go in, download your FCC specific template and start filling that reopening plan in. The staff checklist as well will be available in LEAD, and you'll just go in and fill in a little bit of information to verify that if you have an FCC assistant, that they have completed that required training and their information is good to go. Step 3, also all within LEAD, a part of this transaction is you will be emailed the attestation form agreeing that your program will adhere to the minimum requirements. And this will need to be signed by the licensee and will be submitted and in accompanying that transaction there. Once that's good to go, your job as a provider will be done, and it will then go to our licensors. So the licensors will conduct an initial review of this reopening transaction, really just making sure everything is in good standing. We've gotten your attestation, your reopening plan, your staff checklist, and completed all the required fields. And once everything looks good to go, your program will receive provisional approval and be able to reopen and start providing childcare. Within 60 days, your EEC licensor will review this reopening plan, look through your responses in more detail, work with you to help improve it if needed, or help you think through some more strategies, and we'll be in contact with you within that 60-day period. Once your reopening plan is approved and everything is good to go, you'll receive also via email a final approval letter, really letting you know your plan has been approved, you're good to go, and the EEC is confident and is there to support you in implementing the minimum requirements and reopening your program. And one thing to note here as well is this process is occurring within LEAD, so it'll be kind of a system that you're familiar with and able to use. And with that, we are going to walk through the reopening transaction within LEAD to show you all how you'll complete this and the steps that you'll go through within the system. And with that, I will turn it over to Lynn to show us the transaction.
Hello, everyone. I'm very excited to show you the new reopen transaction that we have developed for you that you can use to let EEC know that you would like to reopen your family child care program. So when you log into your LEAD portal, this is your homepage, as you know. There are two ways that you can get to the new reopen transaction. There's going to be this banner message on your homepage that will contain a link here that will bring you to the transaction page, or as usual, you can click the new transaction link on the left-hand side that will bring you to the list of available transactions. And here we see the FCC reopen application, which tells you that this is the right transaction for you to use to reopen your program after the COVID-19 closure. And this is where you're going to be submitting your documentation and your plans. So if we just click on the application name and confirm that we want to actually start working on this application. The first page of our transaction, as is normal with most of our transactions, is an instructions page. It will tell you what you're going to need in order to complete the transaction. As Margaret was just mentioning, you'll be uploading your reopening plans, a staff records checklist, the certificate of completion for your EEC health and safety training, and your attestation form. So you'll need to have those things ready in order to be able to submit this transaction, except for the attestation form that will be emailed to you after you submit the transaction. On the first page, you'll just see information about your program up at the top. And then if you scroll down a little bit, you come to the reopening information section. So the first thing that we're asking is for you to let us know what your intended reopening date is so you can supply that to us. Then we're asking if you're currently operating as an EECCP. For those of you that don't know, those are the providers that have been operating as the exempt emergency childcare programs. So if you have not been operating as an EECCP, just choose no. If you have been an EECCP, please choose yes. And then you'll need to supply your EECCP program number. Our staff that has been taking your EECCP attendance over the last week or so has been trying to provide this number to our EECCPs. If you don't have your program number, please just call your regional office and they will be happy to supply that number to you. Next, we need to know what the date is that you plan to close your EECCP program. Below that, you can just update your contact information and your language information if you need to. And then we'll move to the next page. This next screen should look familiar to you. It's about your household members and individuals that are regularly on the premises of your program. We will list the people that we know about that are in your household. If everything is okay, just click the box down below that says that this list of people is fine. If not, click the Add Household Member link so that you can tell us about any new household members that you may have. If you plan to be working with an assistant, you can add the assistant here to this transaction so that your licensor will know about it. Right now, my sample provider doesn't have an assistant associated with her, but she wants to add one. So we come over here to the Add New Assistant button, and there's a search bar. So my assistant's name has Test in her name. So you can just put in her name or part of her name, and anybody that matches that name will show up on the screen. And when you find the assistant you're looking for, just click on it and she'll be added to your transaction. We do ask that you provide a start date, but that's all that you need to give us. End date is not a required field, and you probably don't have an end date for her anyway, since you're just adding her to your program. If there's more than one assistant that will be working with you, you can repeat this process and add as many assistants as you'd like to your program. On the next page, we'd like to know how many children you think that you will be able to care for when you reopen. And then we need to know the amount of square footage that you will be using in your daycare. Down below, under indoor space description, we'd just like to know about any new space that you're asking for approval for. And by new space, I mean any rooms that were not already approved and licensed under the license that you previously had approved. So if you need to add a new room, just click Add Room. Type in the name of the room. What you plan to use it for, and give us a few more details. If you're just going to be using the licensed rooms that are already on your license, you don't need to fill out this section. On this page, you can add your schedule, the days and times that you're open. This information will show up on the child care search. So if someone's looking to find a child care provider in your area, they can see this information about you. So you just click the Add Day link and add the days and the times of the day that you are open. And you can add as many days as you work. I won't go through the whole week, but that is how you let us know what your schedule is. This is the last page that you'll need to do, and this is the attachment screen. So you'll be needing to upload your reopening plan, the staff checklist, and your training certificate for that guidance for reopening child care training. So the reopening plan, we've already mailed out the templates. So if you have the file on your computer, you just click the paperclip here, click Upload Files, find the file on your computer, click it, you'll see the file name underneath here, and then click Upload, and it will upload into the transaction. When you come back to that first screen, the status changed from unsubmitted to submitted, and that's how you know that the file was attached. The staff checklist is something new for you, so you need a blank checklist to fill in. That's what this link up at the top is for. If you click this, the staff checklist will download to your computer. So if I click that, the file downloaded to my computer down here, and I can click it and open it. So if I click Enable Editing, it's going to let me fill this out for myself and any assistants that may be working for me. there's also an instructions page if you need any help filling out the checklist. And then you can save this on your computer. And when you need to upload it, you click that paperclip and go through the same process. You click the Upload Files button, find the checklist wherever you saved it to, click Upload, and it will upload it to the transaction. Your training certificate, when you've taken your training, you should save the certificate to your computer and follow the same process to upload that. Click the Upload Files, find where you saved that certificate, click on the name and click Upload. And now you've got all of your required documents uploaded to the transaction. They all say submitted, so you are all set. When you go to the next screen, you're actually all done entering information for this transaction. This is just your summary and submission screen. You can scroll through and check the information that you entered. If you see anything that needs to be corrected, you can navigate back to the page where you need to fix that information and correct it if necessary. But if you're good to go, you go down to the bottom, you click the checkbox next to Terms and Conditions and click I agree, submit, and you'll get a message that pops up on the screen that says that your transaction has been successfully submitted. Once you do that, right away, you're going to get an email that tells you that we have successfully gotten your transaction. So that's what this email is. And you should be used to seeing this for other transactions. It just gives you your transaction number and says that we've successfully received that. And you'll get a second email about the attestation form. So if you click on that email, it'll explain about the attestation form that we need to, that you need to submit this and send it back to EEC. And there's a link to get to the attestation form. So this has to be filled out by the licensee, by the provider. When you click the link, it automatically opens up the form. And there are several statements as you read through the form that you need to attest to. So in order to do that, you just come over to the left-hand side, and as you click on each one, this little icon over here will turn blue, signifying that you are attesting to and agreeing to each one of these statements. You'll need to attest to each one in order to be able to submit this form back to EEC. So I'm going to go through and make sure I attest to each statement. Down at the bottom, you can see a button that says Submit Signature, but it's not lit up yet. So I can't submit this because I haven't attested to the last statement yet, and I also haven't signed it yet. In order to sign this, it's not like DocuSign. It doesn't actually show a signature facsimile. You just need to type your name in, and that will serve as your signature. Once I do that, I just click the Submit Signature button, which is now turned bright blue, and that tells me that I can submit my form. This gets submitted to EEC automatically. You don't need to upload anything, and it's sent to your licensor right away. Once your licensor has gotten your transaction and your attestation form, they will look to make sure that all of your other documents have been received and everything looks good, but they'll be giving it kind of a first pass look. If everything looks good, they will be then sending you a provisional letter that will allow you to reopen your program. This is sent through email, so watch your email for this letter. The subject will say provisional approval letter. When you open it, it will also say that it's a provisional approval letter inside. It will tell you that you are provisionally approved to reopen as of the date indicated at the top of the letter, which is the date that you told us in your transaction that you wanted to reopen. There's more information down through the letter that tells you that within the next 60 days, your licensor will be going through your plans in detail to make sure that they're okay. We also talk about when your EECCP is due to close and that sort of thing. So there is some good information in that letter. Once your licensor has gone through and approved all of your plans and everything else is in good order, EEC will issue you a final approval letter. That also comes in the email. So that's what this will look like in your inbox. And as you can see, it tells you that you now have final approval to reopen, and your reopen transaction is now complete. So thank you. And Margaret, I will pass this back to you.
Thank you, Lynn. Now that you've seen the reopening transaction, we want to talk a little bit more about the reopening plans and the reopening plan template. EEC released this reopening plan template last week, so hopefully everyone was able to access that. And they're on our website as well in a Word format, so it should be easy to use and download and customize to your program. We really encourage you to adjust or adapt the template as works for you, especially as we know for those that have been working at EECCPs and those that have already started thinking through this, you might already have some notes written together about how you'll implement some of these policies and procedures. Within this reopening plan, we are requiring a couple sections and answering a few specific questions within these sections. The first being the program operations plan, so showing how you'll prepare the program to maintain a safe environment upon reopening. And like we talked about in the beginning of this session, the focus there really is those two major principles, making sure there's no kind of mixing of groups, not playing on the playground with other children, kind of separating that way, and also ensuring that children and educators are not staying in that close contact, but really trying to maintain distance where possible. Second is the cleaning plan, and really just looking here to understand how your program will conduct daily cleaning and knowing that there's a plan in place there. The third is the monitoring and response plan, so how your program will respond if a child or if you yourself as an FCC provider or an FCC assistant becomes ill or symptomatic when in the program. The fourth is the medication administration plan, so how you'll safely administer medication, thinking about the COVID-19 environment. If we're trying to avoid close contact or spread of germs, maybe if you're having to help a child with their medication, wearing a mask or wearing gloves to minimize that contact. And last, if applicable, is a transportation plan, so how you'll safely provide transportation where needed, and making sure you're taking all of those principles from all the other sections of the plan and bringing it into the transportation plan. And the reopening plan template, which was released on June 12th, looks a little like this. Here's a quick screenshot here. It's available on the website, so I encourage you to go download it if you have not already. And within this plan template, it's intended to be really short, really customizable, and you really want to focus in on the blue boxes throughout the template. And this is where the key questions that we're looking for you to answer are. So for the cleaning plan, for example, we've asked, how will you ensure that all areas, materials, furniture, and equipment used for childcare are safely and properly cleaned, sanitized, or disinfected? And with this, we give you a lot of flexibility to answer it in a way that works for you and think through the strategies that work for your program. You can type directly into these blue boxes to submit your answer and just edit the template yourself, put in whatever content you already have or whatever you'd like to include, as long as you're making sure you're answering those questions in the blue boxes. Throughout the template as well, we also have several kind of sample resources throughout noted in the document that you can use for your program as is helpful, but it's not always required. And as you can see below, we had a sample cleaning schedule. You can adopt this cleaning schedule. That being said, if you already had a cleaning schedule for your program, we encourage you to not recreate the wheel and use what you already had. So some expectations for reopening plans, like we mentioned throughout this session, is we really want to focus on the key health and safety principles. So making sure we're minimizing the number of individuals with whom a potentially exposed individual is in contact with, limiting contact between groups, and minimizing prolonged close contact between individuals as much as possible. We also want to encourage creativity and flexibility. We know all of your situations are unique, not even just in the layout of your home, but in the structure of your program and what you all bring to the table with your years of experience. We really want to encourage you to think creatively about how to adhere these principles within your program environment and do what works for you while following the principles that have been provided by EEC. Additionally, the templates are optional, but the questions are not. So making sure you're answering those questions in the blue boxes, but you can adapt the template as needed and what fits your planning purposes. The questions will really be the basis of EEC review. So just making sure that those are completed, that you've thought through them, and that you feel prepared for each of those questions to answer and reopen. And lastly, we're really here to support you. We do not want to be a barrier to reopening, but rather a resource for providers. We know this is uncharted territory for all of us, and especially as a family childcare provider, you're opening your home up and inviting children in and offering your services in a very tumultuous and scary time. And we want to work with you, look forward to working with you in thought partnership and helping think through how to safely reopen. So some quick guidance for developing reopening plans, just some things to look out for and think about when you're working on your plans. We want to avoid any vague strategies. So if you find yourself just repeating the requirements, maybe push yourself a little bit to say, okay, how am I going to do this? And what exactly will I do to make sure that children stay 6 feet apart where possible? For that example there, if you find yourself answering the question, how you'll ensure minimized and not prolonged contact, and you tell kids to stay 6 feet apart, maybe think about other creative strategies like using hula hoops to divide the space or setting up playstations around the area so children are encouraged to go into these separate spaces and kind of keep that distance a little bit. Another example here is, if you say in your plan that you'll minimize and maintain physical distancing during pickup and drop off, minimizing that contact, you might want to add a little more specificity around that. So thinking through, will you stagger pickups and drop-offs? How will you do so? Will you give parents kind of a time to drop off each morning, or will you have them wait in their car until the screening area has been cleared? Thinking through those details will be beneficial to the program, as well as show that your plan is well thought through and you're really prepared to reopen. Other things to consider and just try to avoid is anything that seems like it's not in alignment with our normal regulations or with the minimum health and safety requirements. So making sure cleaning is happening frequently enough, making sure that parents are following safe screening practices, your entry and exit has been thought through, making sure you're storing chemicals in a safe place, all of the stuff that you all know and do every day. We just want to make sure those practices continue throughout COVID-19, even though we know you have a lot of things to think about. And the last piece, when you're looking to submit your plan, just double check for any missing information. Make sure you've answered all those questions in the blue boxes. Make sure, for example, here that you've included your local Board of Health contact information and filled out any kind of required sections there. And this guidance here is really intended to help you through this process. And of course, your licensor will be there for you, and EEC as a whole will be there for you as you're working on your reopening plan and as it's in that 60-day review period to make sure you feel prepared and we're there to help you as needed. And with that, I am going to pass it over to Alicia to talk about the workforce.
Hello, everyone. My name is Alicia Wells. I am the Associate Commissioner for the Audit and Teacher Qualifications Unit here at EEC. I'm going to discuss the changes to the workforce. First, we'll begin with the family child care programs. There are minimal changes to the family child care programs as it relates to educator qualifications. However, we will discuss a couple of background records checks shifts and as well as minor changes to the educator qualifications, along with some modifications in LEAD. In regards to the background records checks process, background records checks is still required according to our background records checks policies and regulations. That means any household members age 15 or older, any persons regularly on the premises age 15 years or older, all FCC assistants, and anyone who will provide services on behalf or affiliates with the program shall undergo background records checks. In regards to the open, EEC has made modifications to its approach to background records checks for family child care programs. Programs may open with provisional approval, even if BRC is not completed. So therefore, if you receive your provisional opening, the BRC must be in process, but it must be completed before the final approval. The full BRC is required, but new educators and household members and persons regularly on premises will be prioritized to ensure expedited reviews and processing. Individuals who were submitted and approved through the urgent BRC process during the pandemic are required to complete the full BRC process. In addition, for those seeking fingerprints and your Massachusetts license or identification has expired, there is an extension to those expired licenses, and they can be used for fingerprinting. In regards to educator qualifications, we have included in the reopening guidance the staffing requirements for your program. One addition to the educator qualifications for family child care programs is now individuals, educators who do hold a center-based teacher, infant, toddler, and or preschool certification can become a family child care provider assistant, certified assistant. The reopening guidance does have the information in regards to this process. One enhancement is that we have added new LEAD functionality. This will allow for FCC providers and educators to update their education profile. Their profile will include their background as it relates to completion of degrees and any other credentials such as CDA, Montessori, if applicable. This update is not required in order to reopen your program. However, it is for informational gathering and for future look at our EEC credentialing process. And now Lynn will go over the new functionality in LEAD and how to update your education profile.
All right, thank you, Alicia. All right, so I'm going to show you that new section on your portal where you can enter your education profile information. If you look on the left-hand side of the home screen on the portal, you'll see the new section called Education Profile. When you click it, it will take you to the Education Profile functionality where you can enter information about your education. The first section is about your high school education. So you can let us know if you have a high school diploma, if you went through a high school early childhood education program, if you have a GED, or if you don't have a high school or equivalent diploma. So if you choose anything except that you don't have a high school diploma, you'll need to supply the year that you graduated high school. And then you're also able to enter your professional qualification registry number. That's not a required field, but we do ask that you supply it if you have it available. The next section asks if you hold any EEC teacher certifications, such as infant toddler teacher, preschool teacher, lead teacher certifications. So you can check off as many of these certifications that you have. The education credential information section allows you to enter information about CDAs, Montessori certificates, early intervention specialist certificates, and pre-K to 2 or pre-K to 3 licensure. If you do hold any of these credentials and you check them off, we'll be asking you for more information, such as the year that you completed it. And then we'll need you to upload a copy of your certificate by clicking the Upload Files button, finding the certificate on your computer, and then clicking the Save button. When you click the Save button, you can see the file that you attached here. but you'll notice that this is as yet not submitted to EEC. The next section asks about higher education. So if you have a degree or a postgraduate certificate in higher education, you can give us that information here. So if you do, you can click yes, and then you'll need to fill out some more information. So the first section asks for the college that you attended. So if you start entering information about the name, that you can then click on the arrow, and it will give you a list of colleges to choose from. If the college is not in the list, don't worry, you can type in the entire name. You'll then need to enter the degree that you earned, your major, your degree type, whether it was early childhood or if it was a related degree or an unrelated degree. This little tooltip here will explain to you what is a related or an unrelated field. And then the degrees are separated into degree clusters. So we ask you to choose the relevant cluster for your degree. And once again, we ask for the year that you completed your degree, and then to upload your transcript. Oops. Once you've uploaded the file, you'll need to click Save. And again, it will list the file that you uploaded and tell you that this is still unsubmitted. If you have more than one degree, you can add another school by clicking the Add a School link. When you're all done, click the Submit button. And that will submit your information to EEC. And they will go through and review the information that you sent, and you're all done. Now I'm going to pass the screen over to Amy, who will talk about supports and resources.
Okay, thanks so much, Lynn. I'm going to be talking about supports and resources that we have available for programs as well as for families. We know that this is a very difficult time for folks, for providers, for educators, for the children and families that we're serving. There's a lot of concern about finances as well as mental and emotional well-being, and just general concerns about the virus and about supporting each other through this difficult time. So if you need support, the next few slides are going to cover financial supports, general supports for educators and programs, general supports for families, and then mental health support. As we think about financial support, modifying reimbursement approaches is one of the things that we're looking to do for July and August of this year to better support programs and families so that they can safely and confidently re-enter childcare settings. In order to receive subsidy payment, programs must both reopen in July to continue receiving payments and reach out to families to confirm that they are intending to return to care. A note is that families may transfer their subsidy placement to a new program if that's their choice. It's also important to note that EEC is committed to providing flexibility during this time. We'll be issuing policies this month with the goal of being both flexible and supportive as programs reopen and as families return to care. Some of the guidance that will be issued is around families if they need to keep children home if they're sick or quarantining, and as well as supporting families in maintaining subsidies through these uncertain times. There's some general supports available to educators and programs as well. I think the bottom line in all of this is to know that you're not alone in this system. We're all opening. EEC intends to be as available and as supportive as possible, and we have some partners involved in that work as well. As you've already heard, the learning management system is one of those supports that's available to you. There is the required health and safety training on the learning management system, but there are also additional trainings that are available to you during this time that you might find helpful. The professional development centers are another resource for you, which during this time will be providing direct but virtual support to programs to support both planning and implementation. There is some information about the PDCs, those professional development centers, in our reopening guidance. And then for family child care programs, we also have family child care systems that are available to help support you and the children and families that you serve. In order to find your nearest family child care system, you can look on EEC's website for a list of family child care systems. And additional supports are going to be added and resources will be added and altered as needs arise. There are also some supports that are available specifically to the families that you're serving. The first is our coordinated family and community engagement grantees. These are locally based programs that provide child development services and resources to families with young children. You can look on EEC's website to find one of these programs near you, and they cover all 351 cities and towns across the Commonwealth. So one will be available right in your community or a nearby community to support the families that you're serving. In addition, in LEAD, there's an online community services profile that can be very helpful to you, as well as the MASS 211 resource, which is a referral to comprehensive services for any of your staff, any of your assistants, your own family, or for the families that you're serving. And then finally, our child care resource and referral agencies are another way that you can access supports for families, both around child care searches and subsidy applications under the new criteria. And again, you can visit EEC's website for child care resource and referral agencies. And finally, we want to touch base around mental health support. During this time, it's a critical component of the reopening program that we'll be offering. We want you to be aware that the Early Childhood Mental Health Consultation Program is available to serve you and your program. It's a service that's available to offer crisis and critical intervention support for children and families and educators. There's also professional development that's available in multiple languages. You can see on this slide that there are some topics that might be of interest to you as you're moving forward, setting up your environment, considering your reopening routines, as well as responding to any behavioral or mental health crises that may arise in your program. There are some additional mental health resources in our reopening guidance. And then finally, there are some further resources that might help as you're considering the reopening of your early education and care program. You can start by reviewing the minimum requirements for health and safety on EEC's website, and the website itself is generally a big resource for you as well as for the educators in your program or your assistant. You can take the health and safety training, which is found in the learning management system. You can look at the Center for Disease Control, the CDC's tools to evolve your COVID-19 child care strategy, which is available right on the CDC website. And then you can also be aware that coming soon there will be a panel with staff from Boston Children's Hospital on healthcare resources for families and operationalizing the minimum requirements. Thank you very much for your time.